Hi, I'm Laura Mize from TeachMeToTalk.com.
Hi, I'm Kelly Hampton.
Hi, this is Chip Gerhart, Chairman of the Board of the National Down Syndrome Society.
This is Rachel Coleman from Signing Time, and you're listening to Down Syndrome Radio.
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 Hello and welcome to episode 23 of Down Syndrome Radio. Mark Owens here with Jason Koski and Rick Kosmowski. We're here to tell you about the dad's perspective on raising kids with Down syndrome. We have another super awesome guest for you tonight, but before we get to that, we thought we would do our little update from around the gang. We apologize. It's been a month or so since our big Signing Time episode, but we're back here with some more good stuff for you, hopefully. How are things over there in Delaware there, Rick?
They're going great. We got a new intro, too. That's big news, right?
Yeah, that was fantastic.
Awesome.
That was Luke.
That is, every time I hear that.
Right in there with Exalted Company. Yeah.
So in Delaware, things are going great. My son is 1. He just turned 1 on the 26th. So it's amazing. A year has gone by so fast.
Dude, that's amazing.
So Logan is 1. Kayla's in second grade. Second grade is going amazing. I mean, talking about school, the teachers really make a difference. And this year we have some amazing teachers. And my wife and I are really excited, and Kayla's really excited about school this year. So it's great.
Oh, I love it when it all clicks. And you already know.
Yeah. You know immediately. It's awesome.
Good year to you, bud. Good year to you. What do you say, Jason?
Things are madness here in San Diego. With everything in general, but I'll keep my update to relevant topics. Let's see. Early September, both Dexter and Eloise started new schools on the same day, so that was an adventure. Dexter started preschool at our YMCA, and it's going pretty well so far. He's doing really great. It would be perfect if it weren't for a couple of biting incidents that we've had, but I think lots of 2-year-old.
Were you giving or receiving?
Giving. Yeah, receiving. I don't even care about receiving. I remember when Eloise got bit one time, I was like horrified, and now it's just like being on the other end of that spectrum is just as frustrating and horrifying. Because we're doing everything we can to try to avoid it, and it seems to be going better this last, knock on wood somewhere, but this last week or so it's been a lot better. So it's good. I think it was a new environment, kind of all kinds of new stimulus and all kinds of stuff. So he's maybe a little too much at the beginning, but it's going really well.
Not the first one,
Yeah, I know.
My wife always tells me they called her the vampire when she was a little kid.
Maybe he's hungry. You got to give him more food.
I know. No, I don't know about that. He kid eats like a champ.
We had problems with Luke with Luke and biting, but he would only bite Kim because with Dad it only happens once.
Dad bites back.
That's not happening again. I can only teach the other kids to use that same tone of voice with them. It'd probably be fine.
And so, let's see. Also, last week here in San Diego was the Everybody Plays. I think it was last year that we talked to Colette and Kelly about that, or maybe the year before even.
That flies by.
Oh my God! So how'd it go?
So it was great. It was great. I mean, I kind of wrangle our children and do these things because it's basically like Colette is not. It's basically like she's traveling for a few days because she's so busy with that. But we did attend like the family dinner kind of thing, wrap up party, and it was great. Met a bunch of families and Kelly again, just a whole bunch of people, and it was really great, really well received. The pictures looked pretty good. I saw a few of them.
Dude, you got to put something up on Downright Awesome.
We should, yeah. Kelly posted a video that she took on her blog, so
Excellent.
Check that out.
Excellent.
Yeah, you should check it out. It's just a really great event, and it's it's kind of hectic.
Did she bring her daughter? Did Kelly Hampton bring her daughter?
Not this year. She brought her son. She has geez, I'm not even sure how old he is. Six months. Eight,
Right.
maybe. Yeah. So she brought him, and then the girl stayed at home this year. So.
Okay. Well,
yeah, that was crazy. And I don't know. That's about it, I guess. Getting up, ready for the buddy walk.
yeah, I would say that back to school is our excuse for probably not having an episode for a month or so. It is always a super busy time. Although I gotta admit, I first of all I love fall as a season, but getting the kids back to school and having a routine is just so nice after the summer, and having them in bed at a decent hour has really been great. So Luke's talking like a madman. That recording at the top of the show is definitely a year or two, maybe more old. He can't shut him up. He can't understand everything he says, but it's crazy how much he talks now. He's in a new school. He did not go to kindergarten. We held him back, and he's doing fantastic. He's also playing soccer. Life's pretty good. That's all I got to say here in Richmond.
Great.
Yeah. All right. Well, you guys ready for our super guest?
Bring it on.
I'm excited.
All right. Our guest is a fellow podcaster. He is from the Children's Hospital of Pittsburgh. He is the medical director of the Down Syndrome Center. The podcast has essentially the same name. It gets called Down Syndrome Center of Western Pennsylvania Podcast. I presume that's sponsored by the hospital itself. It's Dr. Kishore Vellody. Welcome, Kishore. How are you doing tonight?
Oh, I'm doing great. Thanks for having me on.
Awesome.
Yeah.
Well, the first thing we always ask is about your family. You mentioned a bunch of kids running around your house. What do you have for ages and whatnot?
Yeah, so we have my wife and I. We have 4 kids. Got the oldest one is 9. She's what is she in fourth grade now? And then I have a second grade girl and a first grade girl, and then rounding it out at the end is a little guy, 5-year-old boy, and boys are different. That's for sure. So he keeps us on our toes.
They sucker punch you. Girl.
Man.
You were all ready for another one, and then bam.
Well, we actually brought him into the family by adoption, so we knew what we were getting into.
Look at that.
Which makes it even more.
More for you. Just the thought of having 3 older sisters. Oh my gosh, he's doomed.
Yeah. Oh yeah, and he's a ladies' man at school, so because that's all he knows is working here with the girls. So he just goes to school and he plays with all the girls. So
hey, that's not a bad thing.
No, not at all.
What got you? I'm assuming is somehow your specialty Down syndrome.
Yeah. I mean, it's not really a specialty like you have to do any extra training or anything for it. I'm a general pediatrician, and that interest in Down syndrome just came about through some family relationships. My brother has Down syndrome, and so he and I are really close in age. And so when I grew up, his friends were my friends, and my friends were his friends. And so, even though I don't have the extra chromosome, I think sometimes a lot of my mannerisms might reflect that I do.
Hey,
but
that's how I grew
up.
Between the two of you only have half an extra chromosome.
That's exactly right. So that's how I got excited about being a doctor in general. And then in 2009, Dr. Bill Cohen, who was really one of the world's experts in Down syndrome, he was the director of the center here in Pittsburgh, and he passed away all of a sudden. And they said, well, what are we going to do? Who's going to want to take over a center? Who's going to want to take over a Down syndrome center? And I said, I'll do it. So it all worked out. It's just, it is what it is. I wish I could have come into the center a little bit of a different way, but after Dr. Cohen passed, I think from wherever he is smiling right now. So.
Oh, I'll bet he is.
Yeah.
It's amazing how things work out that way, and you're just the way here you are, and you're doing this amazing work. And I don't know. I'm really happy that you're on with us today. But it's weird to hear you say "call me Kishore" because you listen to your podcast. I'm thinking Dr. Vellody, and I saw you. I don't know if you mentioned this, but he spoke at the convention over the summer as well. Yeah. And there's a nice series on the podcast of the whole time you spoke at the convention. So it's awesome to have you here. I'm looking forward to hearing all the things you have to cover and the things we can talk about. So
Awesome.
So what sort of special services does the Children's Hospital provide in the Down Syndrome Center?
So this idea of having a Down syndrome center is somewhat new in that our center was made in 1989 actually, and it's kind of cool in that it was created by parents. It was created by parents of kids with Down syndrome who recognized that as good as their local pediatricians were, and they're really good here in Pittsburgh, you just can't become an expert in something if you don't see it very frequently. And just by percentages alone, a pediatrician usually, even if they're a really busy pediatrician, they might only have about 3 or 4 kids that they see every year with Down syndrome. So it gets really hard to know, is that something I need to be worried about? Is this something that you see in Down syndrome? They don't know. And so the families actually, from a grassroots type of effort in the late 80s, started deciding that they wanted to find a doctor and a clinic that would be able to help take care of their kids. And so they created it, and it's funny because that system still remains in place today, in that because of the donations that we get, we're able to keep doing what we do, because the reality is in medicine, insurance companies telling you go see a patient every 15 minutes and see 50, 60 kids in a day and don't spend much time with each of them, because that's just the nature of medicine. But you come and see me in the Down Syndrome Center, and I'm just sitting there and put my feet up, and we're just chatting. And we spend an hour and a half sometimes on with each family. And the reason is that my time is bought. It's bought by the families. It's bought by the parents. And so I'm not on hospital time when I'm doing Down's Clinic. I'm on their time. And you
on the parents'
time.
And you get to be that centralized repository for all of that experience of not just, a couple of kids a year, but probably hundreds or probably more.
Yeah, we see about 450 kids a year with Down syndrome, and you get used to it. After, you see your 3-month-old, you say, you know what, your kid's right on track for 3 months. Or, we need to check this out. That's not something we usually see at 4 years old or something like that. And, it gives us that comfort level. And I think also the experience just family-wise, I've seen every, thing that, at least, from my brother's friends or whatever, every movement that they'll do every time they get excited and they flap their arms around. And, other pediatricians might look at that and say, "Oh, those are seizures. We need to send you to neurology." And I look at that and I do it with them because it's excitement.
Right.
And,
it's bird imitations, right?
Exactly. Yeah. So I love what I do. I think it's giving back to my brother who's given me so much. So it makes me excited to go to work in the morning.
Do you see him still?
He Pittsburgh? He actually lives in Chicago, and that's where I'm from originally. And but we talk all the time, and he's he and I are still best buds. Don't tell my wife, but yeah, my brother and I, we're still best buds. We talk all the time.
So tell me what got you started to do a podcast.
I'm a huge podcast listener. I mean, my phone is full of podcasts. It always has been. It started because when I moved out here to Pittsburgh, all my sports ties were still in Chicago, and so it's really hard to find Chicago sports radio in Pittsburgh. And so I started podcasting all my favorite sports radio sites. And
do you have to, in Pittsburgh, you must have to be sure nobody else overhears or you'll get big trouble.
Oh, man. Especially last weekend when the Bears played the Steelers. Yeah, I actually went to that game here in Pittsburgh, and boy, that was an experience walking in there with Bears jerseys on and whatnot. But it was fun. But yeah, you have to keep in touch with your boyhood team, and you can't do that without podcasting these days. So I got about a half-hour commute to work, and I spend a lot of time listening and thinking about different podcasts that I might want to be interested in and stuff like that. So that's how I got interested in podcasting. And as I was talking to families, and I was realizing that most of my families are of course younger. I mean, the parents are usually in their 30s, maybe 40s, and they're in that generation that likes to use their phones for stuff. And I just started asking around, would it be something interesting to you to have a podcast? And almost universally it was, yeah, I mean, we would love to have more information. So I said, well, let me find you some podcasts. And I went on and I searched iTunes for Down syndrome, and I found your podcast, and I found some old defunct ones that really aren't updated anymore.
Right, yeah.
And realized there really was, I mean, I love what you guys do, but there really wasn't anything purely from a medical perspective for families to kind of get short bursts of information about different medical topics. And so that's where it started earlier this year.
You know,
And how hard is it to remember what the doctor says?
Oh,
That's
yeah.
There, you know? And to have
Yeah.
this to play back is fantastic. I'm so
Yeah.
glad you did it.
Yeah, what's really cool is as I'm sitting there in the office, a family will say, "Oh, what do you think about?" I can't remember what you said about sleep apnea. I said, "You know what? I'm going to put it in the note, but also listen to the podcast." And and it's like it gives me another way of continuing the conversation even after the visit, which I think is a neat part of it too.
Plus, it
so
makes
we
you
put it
hip.
up on the hospital website. It's www.chp.edu/DSC podcast, and it's available for free for anybody, or you could search on iTunes and pick it up from there. But yeah, it's been pretty amazing. I mean, I think we've had almost 4,000 downloads now since February, and 35 countries or something like that. Kind of strange countries that don't speak English or listen to the podcast. I think that's kind of cool.
Sure.
That's the most powerful part, right? People, you become used to having a resource like a Down syndrome clinic near your house or a hospital that can support you. And then, there's a lot of people that just don't have that around them. And look at this information. Here it is right at your fingertips.
Yeah.
That awesome.
So now I was able to figure out what's in the picture from your background that you gave me.
That's right. Yeah, the podcast picture. We've had families ask, who are those kids, and what's with the '70s sofa, as you guys asked earlier before we started recording.
Oh, it's awesome. It's a memory bringer backer. Yeah.
Oh yeah, that's me and my brother, and the shirt that I'm wearing in that picture, I'm the one with the big ears. He's the one with Down syndrome. I'm the one with the huge ears in that picture. And the funny thing is, I asked my mom the last time I went home. I said, I think that's really cool that you put me in a shirt that says, a beautiful child, so that I knew that I was a special kid too. And she said, "No, man, that was a hand-me-down." so so he was the special child. So I think that's pretty funny.
Yeah, that's
She's
good.
That was your fourth shirt of the day.
Exactly.
Right, because you had to keep that chair clean.
Oh yeah.
Oh, classic.
And does the chair exist? And how can we get it? Right.
I don't think that. I think that chair is long gone.
I think I saw it in a Starsky and Hutch episode myself. All right. Well, what did you guys want to talk about? I had some ideas, but I always tend to dominate things. So let's throw some topics at the doctor.
Awesome. Well, what are you seeing as the thing people are asking you the most about lately at the clinic? What's the hot topic?
I guess the hot topic, just in general, within all of us who take care of kids with Down syndrome and even the parents, is the new guidelines that came out in August 2011 that were specific for the care of kids with Down syndrome. That was the first update that we've had in about 12 years. So a lot of research had come into play that hadn't really gone into a guideline yet. And so in 2011, when they updated the guidelines, it was definitely a need. But the biggest part of the guideline, I think that's been the hardest part for a lot of families and their kids, is that sleep studies are now recommended for all kids with Down syndrome by the age of 4, because sleep apnea, we know, is so common. And the hard part with that is, if you don't live in an area like a big city where they have a pediatric sleep center, good luck trying to find a place that'll do a sleep study on a child, let alone a child who may have a lot of facial sensitivities because of the Down syndrome. And so that part of the guideline is a big question for a lot of families who say, well, how's my kid ever going to get a sleep study done? He hates going to the barber for a haircut. How's he going to have EEG leads on his head? And then even for us as doctors, how are we possibly going to get the kids who live in the middle of rural somewhere, how are they going to get a sleep study? And so these are some questions that we're still trying to answer as a medical community, but it hits home for the families too. And I think that's been the biggest question of, how important is this, doc? And, what are we going to do about it even if he has sleep apnea and things like that? So I know, some of your kids are at that age, but some of your kids are a little bit younger. But yeah, it's a big question.
Hey, with the sleep apnea issue, we had the sleep study, and Luke didn't have it. He slept perfectly. But what are the implications of if turns out you do have sleep apnea? That what are the impacts that you're trying to avoid by catching it early?
Yeah, we used to think, just in pediatrics in general, we used to think that sleep apnea is kind of no big deal. Like grandpa snores, well, you know what, his grandson snores too, and it's no big deal. But the thing is that we found over time is that in sleep apnea that starts in kids, especially, your body is chronically oxygen deprived then overnight. And so because of that, your body goes through like compensatory mechanisms. Like it's as if you're living in, high altitude all the time because you're so oxygen deprived every time you go to sleep. So your body kind of revs up its, hemoglobin production. You start to be like those athletes that go to train in Denver for the Olympics or something like that, when really you're not living, probably in that area. And what that does is, if it's chronic like that, over time it can lead to higher pressures in your lungs, and your blood has to pump from your heart to your lungs, and so it puts then backward pressure on your heart, and then you get changes in your heart that you don't really want, and so you can get some irreversible changes to your heart and lung anatomy just from having untreated sleep apnea. And then we're finding that a lot of kids have behavioral problems that are maybe diagnosed as ADHD or some sort of, behavior outburst. And really what it is, it's a chronically sleep-deprived child because of their sleep apnea. Even though their eyes are closed, their brain keeps waking up to keep them breathing over through the night. And so behavioral problems are something we see. We even see growth suppression in kids who have untreated sleep apnea. So they may not reach the final height that they could have reached had their sleep apnea been treated. So lots of things like that can go into untreated sleep apnea.
I was going to make a joke about us all knowing what sleep deprived felt like, but it sounds like it's kind of serious.
Yeah, it definitely can be. It definitely can be.
Yeah, Kayla's sleep study. She was diagnosed with moderate, and we have a recommendation for tonsils and adenoids to be removed. So I think that's the next step for us before you do, I think, the mask or things along those lines.
That's right. I mean, they usually start with that. The problem is in kids without Down syndrome who have sleep apnea, if you take their tonsils and adenoids out, about 90% of the time they're going to be cured from their sleep apnea. That's the end of that. But in kids with Down syndrome, because there's probably even more areas of obstruction even beyond the tonsils and adenoids, those are only about 50% curative in kids with Down syndrome. And then you still have another half of the kids then that still have sleep apnea, even though you had them go through the tonsils and adenoids. And so that's another reason why the sleep apnea recommendation is a little bit controversial. Controversial is because the treatment for it in Down syndrome is very difficult. It is still, the first step is still tonsils and adenoids, but then again, you still have about half the kids that are still going to need some other treatment, be it another surgery to find another area of obstruction, or maybe the CPAP mask like you were talking about.
Sure. I'm looking up for that document that you said came out. Is it Pediatrics, Official Journal of the Academy of Pediatrics,
Yep.
Health Supervision for Children with Down Syndrome? I'm going to make sure to put that in a link to that in the show notes.
Yeah, it's in the August 2011 Journal of the Pediatrics. And actually, there's just recently they released parent translated guidelines, essentially. So even for those not medically oriented, they have translated the guidelines into a parent handout. Now I'll have to figure out where exactly that ended up going, but this just came out within the last month, where a group out of Indianapolis put together parent guidelines as well.
Well, Rick, that was an awesome question. So I kind of like the idea of, because you see so many kids coming up with something that's kind of a trend. Is there anything else like that, Doctor?
I mean, like a new trend, not quite, not so much actually. I mean, there's actually, as I was talking to you, I was somewhat cheating and trying to find it. It's actually at healthychildren.org, where you can find the parent healthcare guidelines. So Healthy Children is all one word, .org, and then just type Down syndrome into the search field, and then you'll find the parent guidelines as well. So as far as other trends that we're seeing, in terms of medical stuff, I mean, it's pretty much, a long trend, I guess we could say, dating back into the the end of the last decade was really the way that we treat kids with Down syndrome has changed over the last, I'd say, 10, 20 years or so. It used to be until really the early 80s that if your child with Down syndrome had a heart condition, let's say, that needed a surgery, the doctors would say, sorry, no surgeries, your child has Down syndrome. And that's a really sad commentary on where medicine was. And now, of course, that's not the case. And in fact, they just recently have released some studies that have shown that kids with Down syndrome actually do better in terms of recovery from certain cardiac surgeries than kids without. And I just think that's a really amazing testimony to say, here's a group of kids that weren't even offered heart surgery, and now we have stuff coming out saying, actually they do better sometimes. I think that's a neat way that our kids have, again, shown how they're more resilient than we thought.
Now, one question I always want to ask with the heart defects and the surgeries is, the thought of heart surgery scares the hell out of me.
Oh, yeah.
So, what are the let's say, I don't know, the chances of some sort of problem occurring during something like that?
It's really important that wherever you get, if your child needs to have heart surgery, wherever you get it done, that you really ask tough questions to the people who are going to be doing the surgery. How many of these have you done? How equipped is your hospital in terms of, is there a cardiac intensive care unit where if things, if they need a little bit extra support, is that going to be available at the hospital where you get it done? And, are the cardiac surgeons skilled at what they do? What are their outcomes? All heart centers keep track of those types of numbers. 99.7% of our kids do great with this particular surgery. I mean, they keep numbers like that because it's how they show how the quality of the care that they provide. And then beyond that, some other areas that people don't even think about are the anesthesiologists. Are they pediatric trained? Are they used to dealing with kids with Down syndrome as well? Because the anesthesia risks are different in kids with Down syndrome, and there are certain types of anesthesia you would use in kids with Down syndrome that, if you're not used to working with kids with Down syndrome, you may not know that you're supposed to be using those types of anesthetics and things like that. So my suggestion to families always is make sure you're comfortable with the people you're getting the surgery from, both the hospital setting and also the doctors who are going to be, and nurses who are going to be working with your child.
Yeah, that anesthesia thing was something I wasn't really prepared for. So when Kayla had her biopsy for celiac, it took her a long time to come out of it, and she was in a different place for a while. It almost took a day to wear off. So yeah, it's something to prepare yourself if you're in that situation where you're going to use anesthesia for something.
Yeah, there are definitely anesthetics that kids with Down syndrome tend to be a little bit more sensitive to. And you're right, sometimes it does take a little while to wear off. Sometimes there can be a lot of nausea and vomiting, even more maybe than other kids.
It's funny, you were talking about things that you don't really think about, but things that our kids with Down syndrome are strengths from a medical perspective, recovering from that surgery, or something more simple like not getting as many cavities. I thought that was a surprise.
Yeah.
I'm hard on her for brushing her teeth every night, and I'm like, okay, you might be okay. So
it's definitely a reduced risk for cavities for kids with Down syndrome. Not zero. We still get our Mike Tyson mouths, in our clinic too. I mean, with all the teeth capped and whatnot. But yeah, it's definitely a less incidence, and also some other things that, I mean, they never tell you this stuff when your kids are first born. I'm sure you guys remember how you were told, and if you're like 95% of the people, it wasn't the greatest experience in the world, and one of the things that I think is important for families to know is there's actually health benefits to the extra chromosome. Kids with Down syndrome, they don't get atherosclerosis, which is those plaques, the cholesterol plaques in the arteries around their heart. The things that give people heart attacks and whatnot. They don't get those. We don't know why, but we know the only difference between them and us is that extra 21st chromosome. So there must be something on that chromosome that's protective. And so, the National Institutes of Health, the NIH, funds studies to find out, well, what is it that they've got so that people like us can, eat all the tacos and whatever else that we want, have cholesterol as high as we want, and we won't have a heart attack. they don't get hypertension. They don't get high blood pressure. We don't know why. They don't get solid organ tumors. So that means like, brain cancer, liver cancer, small intestinal cancer. When you talk about celiac, they just don't seem to get those. At least not nowhere near the frequency that we have who don't have Down syndrome. And so, and I think those are some really amazing things. We talk about all the things they're at higher risk for, but my goodness, there's some things that it's kind of cool to know that I don't have to check the cholesterol. He's going to be fine. That kind of thing.
So cholesterol could still be high, but the plaque just doesn't grow.
It just doesn't form. Yeah. Yeah. And nobody knows why. And again, all of these are active areas of research. How can I smoke 2 packs a day and not get lung cancer? There must be something on the 21st chromosome that the tobacco companies would love to find. You know what I mean?
There's a funding source for you.
Yeah.
That's something that is not necessarily medical in nature, but the funding of research in Down syndrome is something that we always point out. It's so underfunded compared to other other genetic disorders compared to the number of people affected. You have any opinions on that, or does your hospital do some research as well, or anything like that?
I have pretty strong opinions on that, and I think most people who work with kids with Down syndrome have the same opinion, which is it's a sad commentary on what we fund and what we don't fund for research. And here's a group of people that offer us so much in terms of a society, in so many different ways. Yet when it comes to research dollars, we don't respect them in the same way that maybe we do some of the other conditions that are out there. And I think a lot of the way that scientists probably think is, well, here we've got a condition that, with all this new prenatal testing, I guess that's a hot button topic we could have talked about earlier.
We can talk about that.
But with all this prenatal testing, there's this thought that, well, Down syndrome may not be around for much longer. That's kind of the mentality that a scientist might take to that. And I disagree. I mean, I think that there are several, there are way more people who would maybe know the diagnosis is coming, but yet not choose to terminate the pregnancy than scientists are really giving them credit for. But I think that general mentality might affect some of the funding. And then we've tended to be, as a community of people who have family members with Down syndrome, we've tended to be too quiet. I think we take that that mentality too much. I mean, you talk to people who are families of people with CF or some of the other higher funded cystic fibrosis or some of the other higher funded research. They have a very active campaign to keep that research alive. We're just now getting started to do it right, but so I think there's a real hope for turnaround. But boy, it's gonna be a little while.
Well, I think the view that needs to be changed is there was this, so there's an extra chromosome in every single cell in the body. What are you going to just do that many surgeries or whatever? And this, presumption that it could not be cured. But at the same time, there are certain parts of it, the cognitive disability, which is probably the most important to myself personally, and I guess most people, that they've proven that they can work on. So I think we need to change from a mode of acceptance of just saying, well, our children are just a little different, that they're good in their own way, whatever, to saying, hey, okay, for 99% of that's true, but if there were a few things you could fix, cognitive delay being one of them, then let's get on it.
Yeah, and I think the way that we approach research now, if you look at when the scientific papers come out on Down syndrome, it's not what you would see in other conditions. For example, it'll say, 10 patients with Down syndrome were studied, and 7 got better. I don't know as a doctor what to do with that. I mean, that's only 10 patients. And what we need to do, and we're starting to do really much more now, is create registries of patients where families say, I want my child to be in a registry so that if there's research projects, we can, now instead of saying there were 10 patients and 7 got better, we can say there were 1,000 patients in this study and 980 got better with this treatment. We'd say, oh, wow, that's a treatment we should be doing. We need to have that kind of collaboration between different centers and also just nationally in general, being able to share patients. I have a couple of studies that we're involved in now that I'm not specifically doing myself, but we're enrolling families that come to the center, and we say, if you're interested, there's a study going on in such and such a location, and they say, oh yeah, we'd be interested.
But it's all word of mouth because there's no registry.
So that's the big thing that's happened since we last talked. I don't know if you guys is the DS Connect registry through the NIH, and it's open now. And I think it's a controversial topic for some parents, but for me myself, I think it's a no-brainer that we want to get as much information out there so people can access it, and you can participate in studies like that, and we know what the population looks like, and all demographics and background, and now everybody is different things to make you who you are. And I don't know, Dr. Vellody, you probably are thinking, I'm thinking you're thinking this is a great thing that we need to get people to sign up for something like that, or just have their name out there.
I mean, I think anything that furthers the research into helping people with Down syndrome live better lives, I'm all for it. I think a research registry, if it's done correctly and it is with all confidentiality and all that kind of stuff taken into account, which you would assume a national registry would do, I think it can lead to hopefully some invaluable research by some of the researchers that are out there.
So obviously, we're all for this, and the one thing that pointed out was that the site separates usernames from their health information so that individuals may compare their health information with that of other participants in an anonymous manner. This is the NIH's Eunice Kennedy Shriver National Institute of Child Health and Human Development, DS Connect. Maybe we'll put a link for that too, I suppose.
Sure.
It's great.
I don't know, one little thing about that was cool is when we sign up for the registry, it has a map, and it just shows. It doesn't give you any personal information about people. It just shows where other people around the country have signed up for the registry. There's little dots all over the map. So it's a pretty cool thing to see.
I have to do that.
Yeah. Rick is always on top of it.
We should be first adopters.
Yeah. So I have a question. We spoke a little bit earlier about back to school and cold season. And I don't know about you guys, but Dexter, when he seems to get a cold, it always seems to just last a little bit longer and be a little bit harder to get rid of and go a little bit further, into his ears and things like that. So what are some of the things that we can do to? I mean, we're not going to avoid that, but to kind of keep it from progressing.
Yeah, that's a tough
level.
question. It's a tough question because there's definitely a immune issue in people with Down syndrome. Their immune system just doesn't seem to be as effective at clearing infections, whether it be a virus or a bacteria, as compared to other kids. And nobody really understands it completely. We just know that it's there. And then at the same time, for many of the kids, the anatomy of the facial structures, it tends to be a little bit tighter in there. And so drainage of the sinus cavities or of the ears just being able to clear out that stuff is a lot harder. And so the infections tend to fester a little bit longer. The hard part for the doctor then is to figure out, is this a viral infection, meaning it's not going to get better any faster with antibiotics or without, or is it a bacterial infection where, yes, of course you should use antibiotics. And so we tend to make an arbitrary cutoff. If the symptoms are getting worse and have been present for at least 10 days, then we should probably think about antibiotics in those situations. If the runny nose is just a little bit of watery stuff coming out of the nose, but getting better or about the same as it was when it first started, we try to let it ride a little bit longer because there are side effects to antibiotics, and you of course just want to avoid them if you can. So the prevention part is the simple stuff they've been doing for 100 years: hand washing, as much as possible, depending on the age of the kid. Telling them not to share the snots, as gross as that sounds. But, making sure that they don't, wipe one nose and wipe their own nose afterwards, I think is an important thing. And then if there is a concern that there's recurrent colds, I think it's a good idea for those kids to get evaluated by an ear, nose, and throat doctor to make sure that they don't have big adenoids. Adenoids are like tonsil tissue that live right behind your nose. And if those get really big, it further impairs the drainage of your sinus cavity. And I've seen some kids who, once their adenoids come out, their recurrent sinus issues get better. So that's another area that you might want to be thinking about too.
Yeah, we lost a week of school already
Oh,
this year because of that.
Wow.
It's and every year, I think we get like at least 1 or 2 weeks of school missed because of this. And it's good to hear you say that. I mean, you have the cleanliness thing and the just the anatomy. And what about are vitamins or supplements have anything to do with your ability to build up your immunity, or is that? I mean, everybody says nothing's proven, so. Is it more just eating your vegetables, or what do you think about that?
A healthy diet, a balanced diet, I think, is really an important part of maintaining your health. And the hard part is for many of my friends with Down syndrome, it's really hard for them because they don't like the vegetables and they don't like the fruits because maybe the textures aren't what they prefer and things like that, or maybe there's a chewing, swallowing problem or something. And so getting a balanced diet into them can sometimes be harder than you might expect. And so there probably is a role in maybe like a daily multivitamin or something like that. But you will find, and I'm sure you guys have probably come across, there's a lot of folks out there who will sell like vitamin supplements that are intended or specific for Down syndrome, as they call it. And we get a little bit cautious about that, just because none of those have really been studied in any effective way. Essentially, many of the times it's what we call a case report, where you'll say, oh, your child has been on this vitamin supplement thing, and then they'll say, yeah, and he was 2 and he wasn't talking, and now he's 2.5 and he's talking. And you can sit there and say, well, was that the vitamin, or was that just kind of the progress in Down syndrome? And so, without the vitamin, he would have done the same thing. You really can't say without having more, data behind it. And so we don't really recommend those, supplements, just because we don't really know what's in them many times. Many times they come from other countries where of course, there's no FDA type of thing. And so we don't really know exactly what's in them. There have been some really scary stories about supplements that have come from across some borders somewhere, and they've had ADHD medications kind of laced into them, and so they were being sold as a behavior modifying vitamin. But in the meantime, you were actually giving your kids ADHD meds and you didn't know it. I think that's important to keep in mind as well.
So here's a question that might help Jason out. With my older kids, when they first started going to preschool or daycare or whatever, of course they got sick all the time. But eventually they kind of, would be the word, they toughened up. They had gotten their immune system all geared up, and now my older kids, they don't get sick much at all.
Mm.
Does that also happen with our children?
Oh yeah, definitely. I mean, in fact, when they've studied just kids in general, you talk about my kids were all stay at home with their mom kind of thing, and now when they go to school, my goodness, they pick up everything, because when they were staying at home and not in the daycare setting, they were not getting sick very often. And there's been studies that have shown the kids who go to daycare, they get sick a lot during daycare. But then as they get to 1st, 2nd, 3rd grade, their illnesses become much less frequent because they've seen that stuff before when they were younger. And so, yeah, there is some role in kind of the dirty hypothesis. If you let your kids get a little bit dirty, it may not be so bad, because it might actually protect them from illness later on in life. It's just hard for them to deal with it when they're smaller, I think. So there's no right or wrong answer to that question.
We were this is for Jason and Mark too. Watch out with that small like sinus cavity area or something. I don't know. Kayla gets a sinus infection. She wakes up in the morning, and it looks like she has pink eye, but it's really there's nowhere for all that stuff to go except out her eyes. So you're getting all this goop coming out through like your eyes, and I'm thinking, what is all this yellow stuff? And Amy's like, it's jammed up in there. There's nowhere else for it to go. So
wow.
It's just crazy.
Yeah,
that's exactly right.
Ready for that.
Yeah, tear duct obstruction is pretty common in kids with Down syndrome, and they tend to have a little bit narrower tear ducts. It's hard for me to show kind of over a phone like this, but your tears are actually made on the upper outer portion of your eyes, and then they wash over your eyes, and then they drain out through the middle part of your eye into your nose. That's why when you cry, you get a runny nose. Tears come out your nose. But if you have a tear duct obstruction, it can't go through those tubes. And then the same thing happens if you get a lot of congestion in your nose. It even plugs it up even more, and out comes the kind of grossness out through the through those tear ducts right out the middle part of the eye again.
I can picture it now. Yeah. You'd be like, okay, now let me blow your eye.
Yeah, and then you're trying to tell school, no, just get the stuffy nose. That's all.
Yeah.
Okay, right, she's out of here.
Can you write Rick a note, Dr.
Yeah, right. I probably should.
Hey, I had two more questions on my list that Kim asked me to do. That's my wife. She wanted to know about the and I don't have the word right. The axial anterior stability, the neck thing.
Yeah. And
her specific question was, at least the previous wisdom was if you got tested when you were a certain age, which was pretty young, then they just knew that you didn't have it. But, she's heard some people that's not like like you said, like a statistical sampling or whatever, who got tested again just because they were nervous about playing sports or whatever. And when they got tested again, they tested positive, even though I had tested negative before. Can you?
It's called atlantoaxial instability. It's got the big long word, essentially, Atlas, which, if you recall from your Greek mythology,
Hercules,
I believe he holds the world, right?
Right. Hercules had to do it as one of his tasks.
Yeah. And so the atlas is in the body is your first neck bone, your first vertebrae in your neck, and it holds your head up essentially. So it's like Atlas holding the world up. And then the axis is the next vertebra down, and it has a little bit of like a little finger projection that sticks upward. And so your atlas, your first vertebra, can sit on that and kind of rotate, which is why you turn your head from one side to the other, because it's rotating on that joint between the atlas and the axis. So it's atlantoaxial instability when that gets a little bit loose. And the reason that's important to know about is their spinal cord also, of course, runs through your vertebra in your body. And so if there's too much looseness between the bones, it can compress your spinal cord, which is a terrible thing because you depend on your spinal cord to move your arms and your legs and your whole rest of your body. And so it is known that in kids with Down syndrome, it is more likely for them to have that instability between the atlas and the axis. And so because of that, we used to do x-rays on all kids with Down syndrome at the age of about 3, somewhere between 3 and 5. And if that was normal, we actually used to repeat it again at 10. And then when they came out with the 1999 guidelines, they said, you know what, that's too much x-rays. Let's not do the one at 10. Let's just do the one between 3 and 5. And then over the next 12 years, they collected a lot of information about atlantoaxial instability. And what they found out was that the x-ray really isn't very good at picking it up. And it's also sometimes too good at picking up things that aren't there. So you could say, for example, Johnny goes in for his x-ray. He's 4 years old. X-ray is totally normal. And then he falls off the trampoline and he just suffers a traumatic neck injury. Well, what about that x-ray? It was normal. Well, it was just a point in time. It really doesn't pick up something that's dynamic like an atlantoaxial instability can be. And then, on the other hand, Sally goes in and she gets her x-ray and it says it's abnormal. And then she goes to see a neurosurgeon who gets an MRI. Well, MRI requires her to be sedated, so she's getting, extra, sedation that maybe she didn't need to get. The MRI comes back and it says, oh yeah, everything's normal, but the neurosurgeon says, you know what, let's just keep getting x-rays. And next thing you know, because of one x-ray that she probably didn't need to get in the first place, she's now gotten 7 more x-rays in her life. And we know that x-rays, they're not horrible in terms of radiation exposure, but if you don't have to get them, especially in a child who has an increased risk of thyroid problems already because of Down syndrome, you really don't want to have to x-ray them too often. And what they found over the last 12 years before they updated the guidelines in 2011 was they're just not very good studies. The x-ray is just not a very good study to pick up atlantoaxial instability. So the recommendation now is if the child has any symptoms of atlantoaxial instability, and that would be neck pain, neck stiffness, like a tilt to the head to one side or the other, arm or leg weakness that comes on all of a sudden, or if they were potty trained and all of a sudden now they're having accidents again. These are signs that there might be some sort of spinal cord compression, and those are kids who definitely should go pretty quickly to get an x-ray, if not just go right to the MRI. But otherwise, we don't do them on kids who are asymptomatic anymore. We just take those histories and then we do exams of their neurologic system to make sure that everything's okay.
But as a parent, you want to know.
Oh,
you
yeah.
want to rule it out. You want to
I
say,
know.
for instance, my 5-year-old with Down syndrome wrestle with my 10 and my 12-year-old, or for instance, my 44-year-old child, which that would be me. And she's like, well, what if he has this thing, and how do you kind of want a certain answer. Is there any way to do that?
Yeah, there really is no test to do it other than your doctor doing a full neurologic exam, making sure that there's no signs of any neck instability. It's so rare. I mean, if you took 100 kids with Down syndrome, 1% of them would have an abnormal X-ray. But of those ones that had an abnormal X-ray, it's even a smaller percentage, like 10 or 20%, that will actually truly have atlantoaxial instability. So it's a really rare condition.
So if my math is right, that's 1 or 2 in 1,000.
It is really rare, yeah, exactly. And so the goal is to look for those symptoms that may be indicative, because it's pretty uncommon to have a completely asymptomatic child develop a symptomatic atlantoaxial instability from tumbling or wrestling or whatever else they might do. What we do try to avoid in kids, though, is things that could result from an uncontrolled fall. So we do tell families, really, if you can, avoid the trampoline. Trampolines are really big moneymakers for ERs in general, but they are also a big concern for us in the Down syndrome community because, kids do silly things on trampolines. They jump on each other. The bigger person jumps on the smaller person, and next thing you know, they're having an uncontrolled fall right onto their head. That is going to, even if your child had a normal X-ray, if they have a little bit of laxity in that joint, it could cause spinal cord issues. So we try to avoid things that might, be an uncontrolled fall from a big height. If they say, "Oh, I love gymnastics," maybe if they're okay with avoiding the rings, maybe do that, or okay with avoiding the, gosh, what does my daughter do? Those uneven bars or whatever. You avoid those if you can, because those things are going to put your child with Down syndrome maybe at a little bit of a higher risk of neck injury.
Yeah, our PT has held off. My son they have gymnastics at the YMCA at his preschool 3 times a week, I think, and she has recommended holding off on doing any kind of somersaults or anything like that for the until we have this test, basically.
Yeah, and the hard part is this test is not going to tell you whether or not he should do somersaults, and this is the confusion that comes out from guidelines that were well intentioned when they first came out, but really weren't evidence based yet. And now, as we look at the X-ray, it's really not a good test. And so, there's I tell families all the time, there's risks in everything we do. They when they get in the car to come to see me at the clinic, they could have had a car accident, and there could have been a traumatic neck injury on the car ride over. But you take that chance. And so I say to families, if your child says, "Oh, I really want to be a football player," or I could play tennis, well, choose tennis. You know what I mean? It's like everything we do has to have some risk and benefit type of analysis. And so I tend not to tell families what to do and what not to do. I just tell them there's risks in everything that we do, and we have to kind of choose as parents what we are willing to take as a risk. But if your doctor does a full neurologic exam and says things check out just fine, I don't know that I would necessarily say toddler gymnastics is something they shouldn't do. I mean there's such minimal risk to the neck in those types of they just kind of jump and do somersaults and that kind of stuff, and I don't worry too much about that in terms of traumatic neck injury. Kids very commonly, even kids with Down syndrome, will avoid doing tasks that cause them pain. Imagine if, I told you every time you bumped your elbow, you were going to get a, that shock that goes down, when you hit your funny bone. Imagine getting that through your whole body. You wouldn't do that. You wouldn't do that thing anymore. They would start to restrict that movement that causes that symptom. And so that's kind of what we're looking for when we're asking those questions is, are they protecting their neck for some reason? And you used to think, oh, it's just because that's who he is. Well, maybe not. Maybe there is a neck issue.
Well,
does that make sense? I know it's a lot of words.
Yeah.
No,
Okay.
no, that's a background in the answer, to be honest.
Yeah.
The question is, how do you tell a 3-year-old has a stiff neck?
Well, I mean,
he's not going to tell you.
I've seen now 3 kids who have come in, and again, that's over the last 4.5 years now. I've had 3 kids that have had atlantoaxial instability that has been to the point where they actually, were developing symptoms. And the one girl came in, she was 4 years old, and she had her neck tilted over to the side. And I said to the mother, why is she doing that? It was my first time seeing her. I said, why is she doing that? Oh, that's her, her torticollis, which, if you know, torticollis is something that babies get when they're, 6, 7 months old, but you shouldn't have it when you're 4 years old. And I said, that's odd. That's not torticollis. And we did the X-ray, and sure enough, I mean, she had terrible atlantoaxial instability, and she was just protecting her neck. Another girl had a fall down the steps and was brought into the ER, and sure enough, her X-ray showed pretty significant atlantoaxial instability. Probably after the fall, it shook things loose in there. So these are some things that we need to keep in mind. Of course, with every child we see, there isn't a child that comes through that I see in clinic that I don't do a full neurologic exam on, because I want to catch that if it's there. Because what a horrible thing to have happen to a child to have a traumatic spinal cord injury that could be prevented. So, unfortunately, the X-ray is just not the answer, and I wish we had a better answer. MRI probably is the best answer, but you're going to put a lot of kids under sedation, and then there's way too much risk in putting every child with Down syndrome through an MRI scanner. So, it's a tough question. It's a tough question we don't have fully answered just yet.
All right. Well, you guys want to move on to Rick? Do you have a story of the week, or do you want to move straight on to moments?
Well, I think the story of the week is October is Down Syndrome Awareness Month.
Yeah.
So, and this is a great way to kick it off. And I think we've all become a lot more aware about things we didn't know about before this conversation. So, thanks so much for being here with us. Sure, that was awesome.
Oh, sure, yeah, no problem.
Well, hang on. We want you to, if you don't mind, we also do our moment of the week where we kind of share a funny thing or whatever. Maybe you have something with even any of your other children, or maybe a patient or whatever that was particularly cute. We tend to share one.
All right.
But I want to mention, I don't know if anybody else's Buddy Walk or Step Up for Down Syndrome is this month as well. I know ours is 2 weekends from now.
2 weeks as well. Boardwalk, Buddy Walk, Rehoboth Beach, Delaware. We'll be there.
All right, man.
I think ours is, I guess, is it 3? It's the 19th, whatever that is. A little bit more than 2 weeks.
All right.
And I guess ours wins. We're next weekend. The Dash for Down Syndrome here in Pittsburgh is next weekend.
Dash for Down. Well, get your teams together.
Yes, right.
Don't wait till the last minute, and have yourself a good time for that. You said it's Down Syndrome Awareness Month. Excellent. Okay, so who's got a story of a moment they want to share?
Taking Kayla to school, and she's second grade now, so you don't walk her up to the door, and so you drop her off at the curb, and she walks up, and just last Friday she walks up and sees another girl that she goes to school with, and she's like, hey, she says, we're from far away here, so you want to walk in with me? And the girl's like, sure, Kayla, I'll walk with you. And they hold hands and walk up a really long sidewalk that goes up into the school together. And I think that was, when you see that as a parent, it's just like the coolest thing in the world, because you're like, this is what I want, I want every day to be like this. And you don't always think it's like that, but it feels like, school's working out kind of well. And I'm really happy to see that with my daughter.
So when she does the long walk, when she does the long walk, does she turn around and look back at all?
No.
Harsh, man.
I know.
Tough.
Right?
I know.
I was just talking to another parent. I was getting their kids getting ready to go to school, and I said, you're like, you want them to be sad that they're leaving you, and a lot of times they're like, later, or they're like, oh man, you're here to pick me up. I don't want to go. So yeah, that's great.
All right, Jason, you got one?
Oh, I'm trying to come up with something. It's things are going very well here with Dexter. He's speaking like crazy and eating like a big kid, and just progressing amazingly over the last few months. So it's going really great. But I think I'm going to go with the we celebrate all kinds of speech in our house, and we had an incident in the I think we were in the car. That tends to be where all my swear words come out most of the time. But I as often happens, I think something spilled or something in the car, and I said shit, and Dexter, and happily repeats things now, and he just said, shit, Papa, and I was like, oh, that's great. It was a happy and
Isn't there a song about that?
Don't say that again moment.
Isn't there a song about that? The
know.
one about he steps on the brake too quickly, and the kids he's supposed to be eating his nuggets, and they all go on the floor, and he says a bad word. God, it's a country song. My brother would know. Anyway, so yes, and there's that movie where he says it in front of the kid, and the kid starts saying the other word. I'll try to keep us with the clean tag, but that was Meet the Parents or Meet the whatever.
Yeah.
Sorry, buddy. Were you able to communicate to him that he wasn't supposed to say that again, or did he display that for Colette the second he got home?
It just goes away. If you don't make a big deal out of it, it doesn't last.
Oh yeah.
At least at that age, if it was my daughter, she would.
She would have told on you. She would have ratted you out in a minute.
Yeah.
Well, I mentioned Lucas talking like a madman, and our dinner table conversations can be quite hectic with the five of us around the table, and really, Alex, my different children are trying to each talk about their day at the same time. My wife might be trying to communicate something that they need to be at this time by 7 or whatever, and poor Luke doesn't get much chance or whatever. But he started picking up something that the older kids do. They'll say something like, I have a question, or some other interjection like that. Well, he started doing that. So we'll be having this, this conversation where it's rapid fire, left, right, whatever, and he'll just jump in and he'll raise his hand and say, I have a question. we all turn to him.
That's awesome.
And he tells the same story every time. I don't know what the words are. It's got something to do with Lightning McQueen, and it ends with him holding both hands up and going, ah! So we're trying to teach him like a question that he can ask, like, how's your day, Daddy, or whatever. He's got that one, but we're trying to give him a stable of 2 or 3 good questions he can ask, so that he can feel that he has the forum at least for a minute during the hectic dinner.
That's awesome.
I have a question. Lightning McQueen, blah 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 blah, down the thing, blah, blah, blah. Ah! And everybody laughs.
Okay.
Same story every time.
Soundbite.
Hey. All right, Dr. Vellody, you get the kind of gist of what we're doing here. You got a good. I realize we put you on the spot. I know.
No, I've always got stories. My goodness, I got 4 kids, and I got a work full of kids, so I got stories. I got one that just happened earlier this week. The youngest son my only son, he's 5 years old, and we have a game that we play in the house. Me and the girls and my son. We just run around and smack each other on the backside when the other person's not thinking that it's coming, and then we laugh hysterically because we think it's the greatest game in the world.
Real highbrow. That's what
it's tough because they start coming up behind me, and I have to pretend like I don't see them, and then I turn around and scare them, because here they come. Well, you think it's a pretty benign game or whatever. Well, my boy came home a couple of days ago, and he was they have that green, yellow, red system of getting in trouble, and he came home on yellow, or I think it was actually orange, like it was close to red kind of thing. And I said, "What'd you do?" And he said, "Oh, I hit a girl on her bottom." And I said, "Why would you do that?" And he's like, "We were trying to play the game." And I was like, "Oh man!" So I went to the school the next day. When I dropped him off, I was explaining to the teacher, and And that's really uncomfortable to explain to your kid's teacher that you play a game of spank the bottom in your house, and he was just generalizing that a little bit. So we talked about who you can smack on the bottom and who you can't. So, but that was kind of it's hard not to laugh when when your kid does something, generalizes something that they shouldn't.
Right. He's just doing what you do every day.
That's right. That's right.
That's awesome.
Yeah.
All right. Well, anybody else? So let's see. Let's plug a few things there, Doctor.
All right.
Okay. So as we mentioned at the top of the show, the podcast I lost it. I went to something else. Hang on. I'm preparing to do the final song. So, well, anyway, it is the Children's Hospital of Pittsburgh, and it is the Down Syndrome Center there.
Yep.
And go ahead.
I was going to say, if you go to iTunes and you type in Down syndrome, you'll see your podcast, and you'll see my podcast right next to each other there, and mine will be the ones with the 70s couch, as you guys have pointed out. And
I love it.
And but if you wanted to get to it, you could get to it right through the Children's Hospital of Pittsburgh website, which is www.chp.edu/DSC podcast. And then you can find our podcasts there available as well.
It says Down Syndrome Center of Western Pennsylvania podcast.
That's right.
It is, yeah. And there are 18 episodes, so go ahead and give them a subscribe and a rating and review. Feel free to give us one too. And then do you have anything coming up, or you want to warn people in the Pittsburgh area to come see you or anything like that?
Yeah, I mean, we see kids from all over, to be honest with you. So, if you're in the area and you're looking for a Down syndrome center, I think even just coming for a one-time check is sometimes something that families will do, and be happy to see you. Just easiest thing is just to call our office number, which is 412-692-7963, and you can make an appointment there if you're interested. I'd be happy to see you.
All right. Well, I did find this other song that I wanted to, but I think somebody'd have to stall for me while I download it. And
You're inspired.
I am inspired.
So Kishore, your buddy walk coming up, that's funding the Down Syndrome Center of Western Pennsylvania?
It's actually run by the Down Syndrome Association, which is the parent group that I was talking about earlier in the podcast. And then through the loving goodness of their hearts, they donate a portion of what they make every year through a variety of different events that they do to the Down Syndrome Center. They've been very generous, and it's why we are able to do what we do.
That's fantastic.
All right, I'm almost there.
So is the center like a full 7 days a week thing, or I know the one here is kind of reserved like once or twice a month?
Yeah, we have clinic about 5 days a month that are scheduled, but then we add on here and there. If a family needs to get in, we get them in. It's the center is funny. It's me and my coordinator Sheila Cannon, who's been doing this for the last 10-15 years, and we have a part-time nurse. So we call it a center, but my goodness, between the two and a half of us, we see a lot of patients, but we all love what we do. So.
And are you doing yearly visits with people?
We try to. When the kids get a little bit older, like into the teenage years, they're doing well enough. I usually see them every 2 years at that point. And then we actually have, this is pretty unique, we have an adult center as well, where once the kids get to be about 18, we send them over to another doctor who takes over the adult health care after that. So it's a full lifespan center.
And that seems to be a hot topic now too, right? So transitioning and post-secondary education, and what are you doing from a health perspective later in life, because people are living longer now.
That's right.
There's a whole host of health problems that you weren't even seeing before now that they're just kind of coming up.
That's right.
All right. Well, it sounds like a good reason to have you back on the show.
Yeah, I'd be happy to.
All righty. Well, we are the Downright Awesome Dads. We thank you for spending an hour with us or so. Hope you learned something tonight. Hope you have a great time at your buddy walk. You can find us at downrightawesome.com/DSR and leave us a comment there, or you can find us on iTunes, as Dr. Vellody mentioned, under Down syndrome. Find both of us, 2 for 1. We'd love a good review there. And then there you go. Have a great month of October. Thank you so much for spending time with us, for sure.
Oh yeah,
It's been a real pleasure.
Driving through town, just my boy and me, with a Happy Meal in his booster seat, knowing that he couldn't have the toy till his nuggets were gone. A green traffic light turned straight to red. I hit my brakes and mumbled under my breath. His fries went a-flying and his orange drink covered his lap.
Remember the orange drink you used to get with McDonald's?
Well, in my 4-year-old said a 4-letter word. It started with S, and I was concerned. So I said, son, now where'd you learn to talk like that? He said, I've been watching you, Dad.
They're definitely watching us.
That's a great song.
They're definitely watching other kids in their class. They're watching everything.
And grow as tall as you are. We got cowboy boots and camo pants. Yeah, we're just alike. Hey, ain't we, Dad? I wanna do everything you do. So I've been watching you.
All right, gentlemen. Thank you so much.
All right. We'll talk to you later.
All right.
Thank you.
Thank you.
All right. Bye-bye.